Hello, everyone. My name is Kia Chu, and I'm from the marketing team here at Litmus. I'd like to thank you all for taking time out of your busy days to join us. We're very excited to have Melissa Bell from Baylor Scott White Health to present on today's topic, Improving Healthcare and Big Data Made for Each Other. We're very excited to have you, Melissa. Thank you so much for presenting with us today. I'll now hand it over to Terry Kyle, our Regional Sales Director at Litmus, to get us kicked off.
Hey, thanks, Kia, and good morning or good afternoon or wherever you are in the U.S. We really appreciate you joining us today for this exciting webinar. As you probably know, Litmos and our Bridgefront courses that are provided through the Litmos Learning Management System speak directly to some of the concepts that Melissa is going to talk about, our training in the Master Patient Index and all of the analysis information that we provide in our training courses is a great benefit to you if you have an interest in big data or you're called upon to make decisions and encourage your team to move forward based on the decisions that you make from data. So we hope that you'll check out the Litmos Learning Management System and the Bridgefront courses as we go here today. But the reason why we're here is Melissa Bell. She began her career in healthcare as a medical technologist specializing in microbiology and virology. She was a biosafety officer for the New Mexico Department of Health. She has a master's degree in health sciences informatics from Johns Hopkins School of Medicine. Melissa worked as a clinical informaticist. She's currently an information services project manager for Baylor Scott White Health, one of the largest, if not the largest provider in Texas. And Melissa is a project manager. She manages several large-scale data projects, including predictive analytics and electronic clinical quality measures. Healthcare data and data visualization is one of Melissa's true passions, as you will be able to tell from her presentation. She thinks that all healthcare disciplines can help transform patient care and operational excellence through better visualization and communication of data. And I can't wait to hear what Melissa Bell has to say. I hope you get a lot out of this. Melissa, welcome.
Thank you, Terry. Thank you, Kia. Thank you, everybody, for letting me share my passion today. We have a lot we want to talk about, but I want to take a brief moment to acknowledge the folks tuning in. I know data is a big buzzword today. I know a lot of people have to use data, see data, work with data in your day-to-day jobs, and some might not be doing that, but want to get started in that. So this presentation is going to be really targeted to how we think about data, and I'm going to take you through the full process that I typically go through and what I think could benefit others to go through and how to, just take this amorphous kind of world of data and make sense of it. So we're going to talk about where to begin, when you start your analysis, how to visualize it, and how to communicate it. And I'm going to distill all the knowledge that I've had from working as a med tech, being very involved in the lab and doing QA/QC on specimens and tests, through my work as a biosafety officer, through my work at Johns Hopkins, working in the informatics world, and also through my work here as a project manager. So you're going to get a blueprint for what has taken me a decade to acquire in a very short amount of time, so you don't have to go through that learning curve. Hopefully you'll be able to get this presentation, pick up quickly, and apply even just a small set of these skills to how you think and view data going forward. Okay, so let me set the stage for what this presentation is and isn't. So unfortunately, if you were hoping to get some Excel tips and tricks, this is not going to be that. That could be a whole entire presentation in and of itself. This is going to be, like I said earlier, this is going to be a framework, a mental model for how you should think about data. This is going to help you in a few ways. One, it's going to be informative for you to start questioning the data that you're seeing, and also for how you, if you do work with data, if you use data, if you're having to manipulate spreadsheets, how you present the data so that you can see the transformation and help enable better decision making, on any kind of level. And you'll be better armed when someone is showing you data. You might catch things that you didn't catch before. And then the last and ultimate goal of this presentation is I want to inspire you. Data, like Kia and Terry and I were talking earlier, data is not going anywhere. It's becoming more and more mainstream. It's definitely the buzz of the healthcare industry. It's the buzz of many industries. But what they're not telling you is that nobody knows how, nobody knows what to do with it. We're all tackling it in different ways. So hopefully you'll find this helpful. So let's get started. I hope this comic appeals to you. Let's solve this problem by using the big data that none of us has the slightest idea what to do with. Some of you might be, feeling that way. And like I said, and just want to reiterate, this is going to be a mental model, a systematic way for you, if you're in that seat, to say, you know what, let's start looking at it and let's dive right in. Okay, so big data. If you're in healthcare, you know what big data is. Basically, everything that we work with is big data. There's almost nothing in healthcare that is small data. Our EHRs are generating tons of data. We're building data warehouses to store this data. We're doing a lot with it. Collecting vitals on all our patients, generating bills and claims, and we're collecting data on everything. And it's like, okay, now what do we do with it? We have the data. How do we use it? So here's where we start. And I want to start with a quote to kind of calibrate, how we start to even just think about data. Never theorize before you have data. Invariably, you end up twisting facts to suit theories instead of theories to suit facts. I want to make the point here that it's really important we become aware of our biases. This is a really important quote, and there's been a lot of discussion about biases and making sure that if you're a data scientist or if you're just someone who works with data, you want to be careful not to try to see into data before you let the data speak to you. And we'll talk more about that throughout this presentation. So the first place that I'd like everybody to start, and many of you, if you feel like this doesn't apply, I'd like for you to, take a step back and really think through, and identify what questions are you trying to answer with your data? What problem are you trying to solve? From what I've seen in my work, both within, massive data projects, is that we get sometimes locked into the data that we're used to seeing over and over. And there's tons of examples of this. A lot of times we're presented dashboards of metrics that were predefined, and no one, in a while has stopped to ask, what else are we trying to see? What does this answer, any of our questions that we're having right now? And if that answer is no, then it's time to stop and go back and think through what are our questions. And I want to take a minute too. There's a great book, and I'll talk more about some resources that are available to you if this is a passion of yours and you're really interested in data, in the discussion and analysis of data. A beautiful question. It's a book about the importance of asking the right questions. And sometimes the simplest questions can provide profound quests to find the answers, because you more often than not don't ever think to ask these basic questions. Well, why am I seeing this? Well, why is it like that? And sometimes that can spark a whole new path for searching the data, seeing the results, and developing that feedback process. So we want to pause, and we want to know what type of questions that you are answering right now with the data that you have. This will help guide me to bring in some examples as we're going through this systematic way for how you think about your data. So a lot of folks are operations, it looks like, and revenue cycle. A lot of folks will have their own data sets, especially if you're in revenue cycle. You have a ton of data, different data sets that you're working with and looking at. So often, in fact, that probably you're used to looking at the same things in the same way. So it's really important here that you try. I mean, it's going to be hard if you're used to working with certain data sets in the same way. It's really hard not to get into that same mental pattern. This would still be really applicable to you. And if you have a brand new data set that you're working with, this would be especially applicable to you, is really to start with what makes up the entire data set. I know that sounds really broad, but if you've not ever seen this data set before, get to know the pieces and parts that make up this data, especially if it's really large. You know, you have thousands of different kind of line items that make up your data. Even if it's smaller, kind of get familiar with what represents what. A lot of times, especially in an EHR, you know, discrete data fields are created at the very beginning when they implement a system, a new application. And sometimes, you know, data is collected in those fields, sometimes it's not, sometimes what they thought it was going to be used for ends up getting repurposed. So it's a good time to just, you know, if you could erase any preconceived notions about your data, if you're already familiar with it, or just if you're not familiarize yourself with just what, you know, start asking yourself these basic questions. And I always recommend starting with identifying quantities of stuff. I can't tell you how many times we started just to look at quantities of things when someone said, hey, something does that sound right? Well, you know, like a recent example is we were looking at some data of readmissions, one of my projects, and we realized based on one of the metrics should have been equal to the number of encounters that we had. And we started to realize that there was not that one-to-one relationship. So we were able to identify that we were missing some data. And that's because we were looking at the quantities. We were looking at the what I like to call the magnitude of our data to make sure it looks right. So this is a great analysis of what can happen, or a great picture to depict what could happen if you dive right into your data before you get a sense of what makes up the whole thing. When you dive into pieces and parts, you might see the data as an entirely different thing. And going back to that quote that I showed earlier from Sherlock Holmes, you know, you really want your data to show you what it is before you assess your own thoughts about what that data is. Because we might all be feeling the same thing and seeing the same thing and working with the same thing with completely different experiences. So just want you to be mindful of that. The other tip, so we started talking about know what questions you're trying to answer and have that very clear. Know what makes up your data set, know what quantities. This is a big one. This is a big one. I can't emphasize this enough. Know where your data comes from. If you've not looked at what the source systems are, or you don't know what your source system is, or you don't know if your data comes from that source system, start asking those questions. Talk to the folks who input the data, understand the processes of how they input the data. Again, going back to some experiences that I've had recently is finding out, as one example, that we were using data from a source system that only gets updated from another source system once per day. So it wasn't real, what we call in the data world, real-time data, which means as soon as the data is generated, it gets populated. Sometimes data will get transmitted in a batch at certain intervals throughout the day. Sometimes it's broken up into chunks. So beware of where you might be missing data. And I always say follow the data flow and create a data flow diagram. So if you've not done this for your data, this will be a really important part, because sometimes when you're showing your data to stakeholders, when you're showing or sharing your data with other folks who have a mutual interest in it, they might glean something about, hey, did you try this system over here, or did we include that facility over there? Unless you make it transparent how you collected your data, people won't know how the data might be viewed. And then the biggest thing here too is you'll quickly see if your data is unreliable. You know, we've had instances where we've realized, oh, we can't use that database at all. They, you know, did a bad job at maintaining it. You know, you start to talk to these what we call the domain experts or the application experts, and you'll find out what the real story is behind the data. So this is an example. Like I said before, just really make sure you know where your data is coming from. Is it coming from a claims database? Is it coming from a data repository? Seeing something so simple, and if you've not had exposure to data flow diagrams, this is a really simple depiction of just a database, which is that kind of, you know, oval picture, and then you just show arrows that show what database goes from, you know, what data goes from what database to another. For those of you who are not in my world, our data flow diagrams get quite complex and quite elaborate. I don't think you need all that, but you can do something simple to share with your team, to share with your higher ups, or communicate down with your team what data you're looking at and where it's coming from. So the other thing is give your data the sniff test. We call it the sniff test because sometimes people will say, something just doesn't seem right here. I don't know if that's just intuition, especially the more you are diving in and digging into your data, the more you'll get that intuition about it. But if you're new to the data, if you've not used the data a lot, talk to domain experts and say, does this look right? Just here's some results. And if someone's generating this data for you, especially if it's someone who works on a reports team or someone who is querying the database to give you results, sometimes it's good to even just go to them and say, can we just talk through these results? And then that will kind of open up into the queries that they did. Because sometimes they leave stuff off, not because they're intentional, but because they didn't realize that it was missing data is a one of the biggest things that I kind of see happen with a lot of different projects. You capture what you can, but invariably there might be something relevant missing. So for example, going back to our data flow diagram, you might have uncovered that, hey, we didn't realize that, this other facility has its own EHR that's populating data, and we didn't capture that. Are we capturing it? So it's those kinds of insights that will help you, going through this process will help you to come to by having the discussions with these folks, by looking at the processes of how they collect this data. And you might find too that some of the data that you're wanting to collect is just not, you're not able to collect it. And that's where your discussions with the folks who input the data and the domain experts who are populating these reports will help you to kind of get a clear picture, to make sure that it's kind of like, how do you know what you know, and being able to make sure that what you know is correct. So we've talked about initial analysis. Now we're going to get into quality metrics. So not everything that can be counted counts, and not everything that counts can be counted. This couldn't be truer in today's world when we have data populated on everything. There's lots of noise in our world, lots of clutter, lots of things to sift through. It's how do you identify, how do you get to the place in your work where you really are able to find what is meaningful for you? Because not everything in data will have meaning. So let's talk about data quality and what we call moving the needle in a direction. Most of you will want to make decisions off of your data or improve results of some kind, whether that's driving, maybe the metrics up, or in some bad cases, driving the metrics down. You'll have to determine what that is. So where do you get started when you just look at quality? So we've spent some time talking about data quantity, how many of things you have, what the magnitude of those things are. Once you are familiar with the magnitude of things, then you can start diving into your quality. Okay, how do we want, this set of data to look? You can start, I always recommend with kind of these, two different, starts. What is our accuracy? Is this correct? Are we capturing this field consistently? Is it getting inputted consistently? We can't make everything in an EHR, in any kind of application. We can't make it all a required field for everything. That would take us forever, and we would never get through our workflows. So we have to kind of do the best we can in some circumstances. So you could start looking at how accurate it is. You could also look at the process of how data gets created. Going back to when you talk to folks about their processes, going back to the quote too, that not everything gets counted. Sometimes just capturing these processes of how this data gets collected, there's a ton of insight to be gleaned there. You might find out that because the tech entering in this data is super busy, they just skip over it, or they were taught to just skip over these fields and never use it. So that makes, an analysis on that field completely irrelevant, because you find out that the process of how this data gets entered is so scattered that nothing's done consistently. So if you do have processes like that, a big way to move the needle is just to document how that process looks, or how that process doesn't look in some instances, and there's a lot of insight to be gleaned there. But when it comes to data quality, I know it sounds kind of crazy, but you want to think about the behavior you're trying to change, because more often than not, you want something to be different about what you're seeing. You're trying to better capture claims. You're trying to, get more money returned. You're trying to change a behavior about something. So when you look at data, and I see this often, is that a lot of times they're not even focused on the data that's related to the behavior. So you don't know if you're moving that needle if you're not focusing on something that is tied specifically to that behavior. So if you've come to the conclusion, yeah, that sounds like what I'm trying to do with my data. If that's you, here's a good place to start. If you're trying to change behavior, and in my world, we're always trying to change behaviors on some level with our data, whether that's trying to get it correct, whether it's trying to empower decisions. I've found that it's best to start small. So if you're trying to improve a process of how data gets entered, try educating to that process, or try educating to the problem. Start small, getting the word out there that you're trying to do this. And you'll see that just by letting people know that you're measuring it, you can actually see the needle move when you get to that point. And this will help you to kind of see, okay, are we having an impact or not? Did our effort produce a result? And that's how you'll try and track your feedback loop. So like an example here, we're only entering data for this field 50% of the time. Well, if we start educating to that, can we bump it up to 60%? If we just start having conversations about our effort, can we drive that up? So just to quote Peter Drucker, what gets measured gets managed. And I can't emphasize this enough. Also, there's a lot of literature that supports this kind of ongoing effort to take a good look at how to make decisions using your data and how to change behaviors using your data. So we've talked about kind of the setting the stage for your data analysis work. Let's talk about quantity and quality metrics. Let's talk about visualization for a second, because we can't just show people our data sets day in and day out. And this is going to be high level. And I have a ton of examples too that I wanted to share with you on how to visualize your data. But I want to give you some ideas that will allow you to build on and expand and come up with your own ideas without just relying on some of the ideas I share with you. I see lots of bar charts, lots of pie charts, lots of line graphs. These are the most common ways I see data communicated. I see them done well, and I see them done not so well. My tip here is to keep it simple, keep it easy to read. If you do have a standard bar chart or pie chart or any kind of graph, give it to someone who's never seen your data before and say, hey, take a look at this. What do you think? Tell me what you see here, and have them explain it to you. Literally have them verbalize what they're interpreting. If they don't interpret it right, or if they can't quickly understand, go back and revisualize. Try something different. Make it more simple. A lot of times people don't either have a lot of patience, and they may not ask you, oh, I don't really understand, or they may not feel comfortable understanding. So it's good to be transparent and say, hey, look, I'm really trying to make this simple here. Is there anything that you don't understand? I see a lot of percentages as well. 50% of people don't understand, how to enter this field. Going back to our previous example, there's insight to be made from seeing and sharing the quantities of your data set. So what does that 50% look like? Is that 50 people? Is that 100 people? Is that 32 people? How many people is that? And how many of those people don't understand? So when you make things clear, people can expand on that. It communicates your data in a whole new way that they're not often used to seeing. And we'll get into some more resources for those of you who really want to start getting into the data visualization world and catch the visualization bug. We can spend some time talking about where you can go to get some ideas. My big push here is think outside of the bar chart. We're in healthcare. We need big ideas. We need to be able to clearly articulate what it is we're seeing. I'm a big fan of infographics. I'm a big fan of just seeing the raw numbers, the quantities of things. I'm utilizing pictures in new ways. So I'm going to show you two examples that I found just on a quick Google search of visualization. These are very simple. They're very easy to see. They tell a story with your data. So think outside of your normal dashboards. Now I know that many of you, especially if you're in operations, have dashboards that you rely on. You can never engage your folks too much with clear examples. I know a lot of people in the data world, if they're not used to seeing and don't have a vested interest in the data. They just will get kind of maybe glossy-eyed. This could perk them up. This could make them, start to care. And if one of these metrics is directly tied to a behavior, they will definitely have more of a vested interest because they can see that their own actions, hopefully if it's related to them or the actions of others, will make a difference versus seeing something that they have no relationship to. So try to search for new ways on how to do that. So I'm increasingly motivated by some of the visualization efforts taking place out there. Some of the dashboards that I have to maintain, I don't have as much of a free reign over those, but I always look for new ways to start capturing data. I don't think it's the person who has the data necessarily has the power. I think the person who understands the data that has the power. So sorry, Tim O'Reilly, I am going to modify your quote just a little bit. All right, moving into communication. And so visualization and communication kind of go hand in hand. Your visualization, a big difference here, your visualization ideally should be able to communicate without you. If you pass your chart along or your graph or whatever it is, can it hold the story without you? Communication, for me, when I have to communicate the data, is when I have to verbally tell it to somebody else, when I have to talk through it, when I have to be able to sit and explain how we collected this data, how we looked at what we looked at, why we selected what we did, and why we left the other things out. I see this happen a lot too, is you're entrenched in your data. You know what a CPI and an ABC and a XYZ is, but your audience may not. So I know this goes without saying, but assume your audience knows nothing about your data. They don't know your language, your lingo. They may not know anything about your data sets or your databases. They may not even know what a database is. But they will know what application you're using, or you can communicate that it's an application. I see a lot of words fly back and forth where I will stop whoever's explaining. I will say, just to make sure we're all on the same page here, can you explain what this means? Because we work within our own domain so often that sometimes we forget that we're explaining something that is a brand new concept or word to another person. Definitely don't use acronyms, don't use abbreviated words. You just don't know what your audience doesn't know, and you want your data to be able to empower them, share a clear example. And the more you muddy up those waters, the harder you're making it for them to make or potentially make, very potentially big decisions or insights from the data you're presenting. For folks like me who have to use quite a bit of technical and statistical jargon, I definitely like to keep it to a minimum. I like to explain things in a way that tries to assess a more simplistic language approach. Certainly, I'm happy to dive into positive predictive values and medians and anything else data related, but I like to kind of create a baseline for what those things are in the beginning. This is a good one, and this definitely needs to be used more in healthcare. This is what we call natural frequencies. So if you're describing things in percentages and you're trying to draw maybe you want to make a case for why something should be done, it turns out that percentages aren't really that great at providing a clear picture for folks a lot of times. So if you can draw on or use natural frequencies in your data, you will definitely help bring clarity where they may not have had it otherwise. So this is a good example. 2 out of 10 people will need financial assistance with healthcare related expenses. People can think in terms of, oh, that would be like me and this room of people and 2 of us. or if you can use natural frequencies and relate it to something else. I remember a good publication, Crossing the Chasm of Healthcare. They were relating to medical-related deaths, and one of the big points was the amount of people that die from medically related events was the equivalent of a jumbo jet crashing every day. So examples like that make it real for folks instead of just, if you put that in a percentage, probably it would be 0.001%. 0.001% of medically related deaths, or a jumbo jet crashing every day. We're saying the same thing, but we're telling a completely different story with it. So look for that unique angle that could communicate what you're seeing, what you're touching in a way that will have an impact and a meaning to someone else who's not, within your domain. So if I can inspire you to do anything from this presentation, don't just rely on percentages. So I want to take an example. For those of you who are familiar with The New Yorker, there was a great article called The Hot Spotter. And Dr. Jeffrey Brenner in Camden, New Jersey, was given access to the medical billing records from 3 hospitals. And he wanted to know, he was given this data, much like many of you, here's some data, what can you do with it? And he wanted to know who were his most expensive patients. He wanted to know where did they live and what quality of care did they receive. So the story goes on to describe how he started collecting the addresses of where these folks lived, plotting them on a map of the city, and he started to realize that a majority of the patients who were most expensive patients came from 2 different buildings that were located in Camden, New Jersey. And he was able to quickly distill down by taking a look at his entire data set that some of these patients who not only were the most expensive patients, but also had the worst outcomes. And he was able to kind of figure out that some really simple interventions, having physicians make home visits, getting some of the folks access to better living situations, had a profound impact on their lives and also on their medical their health and their medical care. Their medical care actually improved. And this wasn't because he just got this data set and dove right into one little quality metric. He looked at the entirety of his data set and just started asking really basic questions. So Atul Gawande, who's a really great author in the healthcare space, if you are familiar with him, take a look at his work, take a look at the hot spotter example. It'll serve as definitely an inspiration for how data can transform the way we operate and the way we apply resources or don't apply resources. So with that being said, let me jump into some of the resources that had the biggest impact on my thought about data. I put websites first because I feel like those are easier to get to. So definitely take a look at Infographics. And this is a blog, PolicyViz, on how to present data. It'll give you some ideas, give you some new ways to think about how you've presented data in the past. 2 books, Beautiful Evidence by Edward Tufts, Calculated Risks by Gerd Geiger-Unser. I really like Geiger-Unser. He definitely transforms the way you think. Now his book is more about risk, but he has many healthcare related examples that make you rethink the way we have clinical decision making and how we present data in the healthcare space. So really, really good resources. I'm also happy to talk with you, talk with you beyond this and stay in touch. I thought I had a screenshot in here with my contact information, but you can reach out to me to have more discussions about your data. You know, I'm not necessarily a domain expert in your world, in your particular data world, but I can help you to think through your data and how you should analyze it, tackle it and digest it, and then create an appetite for your data as well. So that does it for me. I want to leave a few minutes for questions from folks. Kia?
Yes, we have a couple of questions. Melissa, if you're ready for a question.
Yes, question.
The first is, how do you find when you are totally immersed in data that you are sharing with a non-data person? What's the hardest part of that?
Oh gosh, definitely building up, and I'm going to use building up the acuity to how you thought through your data and bringing them up to that point. Typically the ramp up speed for someone to get to the point where you're at, they have to kind of go through their own path. So they have to, you know, ask this question and that question, which you've already asked and thought about, and then, you know, came to this conclusion or that. That's the hardest part for me, just building up that acuity of building up the acuity to where you're at.
But yeah, what are some tips that you can give on helping build that acuity?
The biggest tip I would say is you could probably start before you share it. Tell your story of how you got to where you're at. You know, we looked at these databases, we looked at these processes, we collected this data this way and analyzed it this way, and let them follow you step by step to your thought process. Because if they think differently or had a different question that maybe was different than yours, they can stop you and say, okay, what about this? Did you think about this database? Did you look at this data this way? That will, you know, bring more transparency into how you got where you are.
Here's another good question, and it's not about big data, but what kinds of results have you seen change based on your data? Do you get a chance to experience the benefit of behavioral change or see something? Is there you know, can you see the finish of the process that you've provided the data for?
Yeah, in fact, when we begin some of our data projects, we actually determine what our quality metrics are that we're trying to target up front, and we look to see that those quality metrics are, you know, transforming in the end. Right now, we're some of our big initiatives are focusing on, one of my big projects is reducing readmissions. So we're targeting a whole bunch of different data or different fields or metrics around what that looks like. It's a great question.
That's great.
But yeah, sometimes.
We really appreciate you spending time with us today and sharing your passion in analyzing big data and providing it to the decision makers that need to use it as a tool to do that. Please accept our thanks.
Thank you, Terry. Thank you, Kia. Thanks, everyone on the phone.
And make sure to connect with Litmus and connect with Melissa. You can see the contact information on the screen. Thank you, everybody, for joining us. We really appreciate it. Have a great day.